Good morning. I'm Elaine Wilson. Thank you for being here. I'm a member of the Hunger Ministry, Westminster's Hunger Ministry team, and we are pleased to join the social justice team in presenting this morning's forum. We build the social justice forums around a common theme, and this program year, the theme is Diving Deeper Together so All Will Flourish. This theme builds on our heightened awareness of the systemic and critical issues affecting our community, brought to greater attention in recent years, most especially in response to the murder of George Floyd. Through the forums, we will learn about longstanding needs and become more prepared to support the flourishing of all members of our community. Today, we welcome Theresa McCormick, the Director of Programs and Healthcare Partnerships at Second Harvest Heartland, she will be addressing the impacts of childhood hunger in Minnesota. She also leads Second Harvest Food RX program, which helps connect food insecure patients to nutritious food and education that will improve their health. She has more than a decade of nonprofit fundraising, program, and operations experience. She is an active volunteer with the Citizens League and former president of the Junior League of Minneapolis. For those of you who are in person here, we will have questions during the Q&A time, so please raise your hand and we'll bring around a microphone. And on the live stream, please submit your questions or comments in the live stream chat. We'll monitor that and raise your question and or comment. So with that, I will turn it over to Theresa. Thanks for being here.
Good morning, everybody. Like Elaine said, my name is Theresa McCormick, and I'm going to do my very best to make sure you all can see me over the podium this morning. I'm so appreciative of the invite to join you as part of this series. One of the things that I think has been particularly powerful in the last 18 months of the pandemic response in hunger relief and at Second Harvest Heartland has been the outreach from so many community organizations really wanting to understand not just what hunger looked like before and how it's presenting now during the pandemic, but really what are creative and innovative ways that everybody can engage, that everybody can get involved. And so I certainly want to spend some time this morning just talking about what does hunger look like today? What have we learned from the pandemic? But move into really, especially related to those child programs, where are there opportunities for all of us to be able to volunteer, to advocate, and get involved, and what can that look like, and open it up for a little bit more discussion. I think that's really where the magic and the secret sauce is in these types of conversations. So that's where we'll spend some time this morning. And for those who have never worked with me before, I would much rather have this be a conversation than wait till the very end for Q&A. So if something pops up, please just raise your hand. And I want to make sure that we're really spending the time in ways that is informative, but also inspiring for you this morning. All right. And Siri thinks that I am talking to her. Excuse me. All right, so like I said this morning, we're going to spend a little time before we really dig into when we talk about programs and opportunities to expand programs, contextualizing what hunger looks like, and then again, spending a little bit time at the end here talking about how we can really accelerate this work and what it takes for everybody in our community to accelerate this work. All right, so hunger today. If you had walked into my office 2 years ago, and asked me what hunger looked like, I would have told you that 1 in 11 Minnesotans didn't know where their next meal was coming from. And that was actually a victory at that time. We had spent 10 years since the Great Recession really actively working to expand our food distribution programming and advocacy efforts to fight back the rising food insecurity that we saw after the Great Recession. Now, today, we know that it's 1 in 10 Minnesotans, but that doesn't tell the full story. Because when we look at that number at the aggregate, in fact, I actually just saw a map. It was just published, I want to say CNN had it running, and I saw it on Twitter the other day, that it looked like Minnesota was below average food insecurity, if you will. And when you look at that 1 in 10 number, it's like, okay, well, what does that mean? But we know that that aggregate number really hides what food insecurity looks like in the state of Minnesota. and it hides the story around who is disproportionately impacted by pervasive and persistent food insecurity. So what we know is that with 1 in 10 Minnesotans not knowing where their next meal is coming from, that means that every single community, every classroom, every faith group, every extended family has somebody who is experiencing food insecurity today. But we also know, and the COVID-19 pandemic has just laid this bare, that hunger is hitting communities of color especially hard in Minnesota. We know that our Black, Latino, Asian, and Indigenous families are at least twice as likely as white families to live with hunger. And layering on top of that, we know that seniors, families with school-aged children, so children 18 and under, immigrants and refugees, as well as rural households, are much more likely to experience hunger. So when you start looking at what hunger looks like across Minnesota, it's not a blanket 1 in 10. We see some deep, persistent pockets of high food insecurity. And I think that's the work that we really want to shine that spotlight on. And the COVID-19 pandemic has made it so many communities can no longer turn away to what hunger looks like. And it's important context as we think about what we can learn from the last recession, what will persist, and how communities can really come together to address food insecurity. So just a little bit of context here in terms of what we're talking about with food insecurity versus hunger. I think this is actually important to spend a little time on. When we talk about food insecurity, we know that it can have oftentimes be exacerbated by, or somebody can become food insecure by a change in economic circumstance. So what I mean by that is a car accident, unexpected medical bill, layoff, divorce. Those life events can really drive episodic food insecurity. But we also know for many, many, many people that the circumstances that lead into food insecurity are much more complicated and pervasive and deeply rooted. So we're talking about things like living wage, affordable housing, accessible transportation, accessible healthcare and affordable healthcare. And certainly we can't talk about food insecurity without also talking about persistent racism and discrimination. And so we know that hunger itself, that individual experience of hunger, it is solvable. But when we think about the work of the food bank and the work of our communities coming together, we want to be able to both meet that need today that somebody might be experiencing of hunger, as well as address those systemic contributors to food insecurity. So our work at the food bank, we really prioritize 3 primary ways that we engage. We certainly want to provide better services that really address the hunger that exists today, develop programs that help advocate for and engage people in food security, and we'll talk a little bit more about what I mean there, as well as advocating for policies at the state and federal level that address those deep root causes of hunger. So again, just coming back to, we share this as the hunger calculator for what does this mean then for folks sitting around the table who are having that conversation of oh, how are we going to make ends meet? The reality is this is what it looks like for so many people. It's those difficult daily decisions about how we're going to make ends meet to get our basic needs met. Specifically, we know in our last surveying that households are often facing the decision between paying for food and utilities, food and transportation, food and housing, as well as food and medical care. And those are often the pain points for folks where they really start to say, food might be one of the easiest things in my family's budget to stretch because I have to put gas in my car to get to my job, because I need my medications to stay healthy. And so food becomes, again, that really stretchy item in family budgets or an individual's budget, and often one of the first things to go. I shared this story with the permission of the woman that we were working with. We had a caller, this was pretty early on in the pandemic. She called our food resource center. Single mother, head of household. And this conversation really stuck out with me because I heard the same conversation over and over and over again, which is, I will do anything that I can to make sure my kids are fed first. I'm okay being hungry. I'm okay making sure my limited food budget goes to the kids first. And I have to choose the gas to keep my job. And I have to choose my child's medication. I have to choose these other things. That was a non-option. And so for her to call us up to say, you know what, I'm really scared to go to my local food shelf. I don't know what I'm eligible for. I've never been on food stamps before. And she had actually at that point been experiencing a couple months worth of food insecurity because of a job loss early on in the pandemic. That is what hunger is really looking like in Minnesota today. And of course, there are long-term, both short-term, but really long-term and lasting impacts of food insecurity. Even when the food insecurity may be episodic for somebody, they may need 8-9 months worth of additional food support to make it through a life circumstance change. That can have lasting and lifelong impacts in terms of health outcomes, but it becomes much more like it's the ripple effect, much more lasting when we start to talk about children and when children experience food insecurity. Because we know that it will not only impact their health outcomes in the short term, they're much more likely to miss school, experience chronic absenteeism in school, much more likely to develop other health conditions. It can also impact their growth and development, brain development in particular, as well as their long-term ability to learn in school. Of course, that has then, it's been well studied, impacts then on will children be able to complete their high school education? What does that mean for how they go on and their earning potential over a lifetime? And so the data has made abundantly clear, the earlier that a child experiences food insecurity, pardon me, and the more persistent their experience of food insecurity is, the greater that impact is over their lifetime. And we see it in, again, attendance in school, graduation rates, test scores onto lifelong earning potential. And so hunger is one of those pieces that, from our perspective at the food bank, it is something that we can really rally around, not only as a way to meet the need today, but frankly as preventive care long-term for children. I did want to share another story from a father that we had worked with here. So Baba here is up on the screen. I'll let you read his story in his own words. But he visited a drive-through grocery distribution that was hosted by the Senna Foundation over at the Conway Community Center in the east side of St. Paul. So Second Harvest Heartland's partnership with that organization, Second Harvest Heartland provides much of the produce, the dairy, shelf-stable boxes through that distribution, and we partner with the Senna Foundation to connect directly with those families. The Senna Foundation does so much fabulous programming in the community, as well as the Conway Community Center. And so we really look to establish those types of organization level partnerships where Second Harvest Heartland can bring the food and those resources into community programming and fully integrate that. And, Baba certainly shared the impact that has made for him. But this is the story that we see countless times over and over and over again. That Second Harvest Heartland can really look at does the food exist within supply chains? Where is there healthy, nutritious food that is available, and how do we connect that to communities faster and make sure that it gets to those kitchen tables like Baba's? So in this example with the Senna Foundation, we distributed in partnership with that organization about 300 to 500 boxes to households weekly through the course of the pandemic, and that's continuing on to this day. Oops, pardon me. So again, the food bank, as we think about like everything that we have learned through the pandemic, what hunger looks like right now, we're continuously enhancing our operations and programmings, especially our advocacy work, really to ensure that we are addressing those things that create and perpetuate hunger in Minnesota. Because the reality is it's harder than ever to face food insecurity in our state. We know right now 63% of Americans currently are living paycheck to paycheck. And what that means is new hardship, especially unexpected hardship, makes it particularly hard to be able to make ends meet and meet a family's basic needs, particularly for food. We also know that while some economic indicators are improving from the last 18 months, it's unequal across industries and unequal across communities. And we also know that many public benefits programs like SNAP, or formerly food stamps, they hang in the political balance. And so access to programs really becomes of vital importance, particularly for the communities that are experiencing that disproportionate impact of hunger. So like I mentioned, while it took more than a decade to really undo the rising hunger that we saw after the last recession, what we're facing now is an even bigger challenge within the global pandemic. And so that's a big part of like how we're thinking about then where do we continue to respond and where do we need to continue to accelerate as a food bank, and frankly really understanding again that hunger is not experienced equally across our state. And beyond economics, far too many of us right now in this moment are living with these long-term health impacts of the pandemic. That is both folks who have experienced COVID and maybe experiencing longer-term symptoms of COVID, as well as families who are coping with losses due to the pandemic. We are also seeing long-term health impacts from frontline workers, untold stress on families in the last year. It all adds up to greater struggles with health and hunger. So, pardon me. The other piece, and we had talked about this, just briefly, when we talk about the fact that BIPOC Minnesotans are twice as likely to experience food insecurity as white Minnesotans in our state, what we refer to that as the racial hunger divide. And you'll hear many times at Second Harvest Heartland, we'll talk about how is the organization addressing that racial hunger divide. Not just shining a spotlight on that, but where are we mobilizing our programming to go deeper to address the racial disparities in access to food. And we are committed to addressing the racial hunger divide. So we're taking immediate steps to be able to really invest in these primary areas that you see on the screen to address the racial hunger divide. That includes things like distributing more culturally connected foods, especially produce items, culturally connected produce. Well, when we talk about culturally connected produce, that also means expanding and deepening our partnership with farmers of color and ensuring that the funds that we use to invest with growers is going right back to BIPOC farmers. It also means that we are increasing and expanding our distributions of food directly to communities of color through partnerships, like I mentioned with the Sena Foundation, so new and deeper partnerships, as well as door-to-door distributions, neighborhood food drops, and shoring up our SNAP outreach program to put more purchasing power in the hands of folks who are experiencing food insecurity right now. And it's just the beginning of addressing our work, but we're really proud of the steps that we have taken. In fact, you may have seen recently, Second Harvest Heartland announced a $13 million investment in all of these initiatives to not only do this work here in the areas that Second Harvest Heartland serves, but again, to really expand and deepen the work that we're doing. And in many cases, like with the SNAP example that I shared with you, do this work statewide. I lost my clicker. So this is why we are on a mission to end hunger. We really feel an immense responsibility to our communities who are experiencing food insecurity. The most recent stat that I had heard is that about 84% of the food on food shelves, if you will, comes from Second Harvest Heartland. And so when I say immense responsibility, I mean an immense responsibility to understanding not only how we can deepen the work that we do, but expand the work that we do, particularly to address the racial hunger divide. So now let me get into like how we do this every day, and especially as we start to bring it into what are those programs that are serving families and families with children. All right, so when we talk about our program areas, certainly I think it's important to touch on what I would call the foundation of food banking. So one of the ways to think about a food bank is putting food on food shelves. If you were to have visited us 40 years ago when we were founded, what we would have really highlighted is all of the great work that's happening in our warehouse, the ways that we are seeking donations, partnering with retailers, partnering with farmers, manufacturers, to ensure that any place where the surplus food is gets rescued. And that rescue comes back to Second Harvest Heartland so that we can work with volunteers to turn that into, say, a 5-pound bag of potatoes instead of a 2,000-pound bag of potatoes, right? How do we make it accessible so a family can take those items home tomorrow? But there is the other side of hunger relief, if you will. So much of the work that people know Second Harvest Heartland for is what I call feeding the line. Again, how do we make sure that there's food today or food tomorrow for somebody who's walking into their local food shelf and they're at that moment of, I don't know how I'm going to make ends meet. But we also think a lot about where are the ways that a food bank of our size and of our resources can really drive food security, or what we call shortening the line. And much of that is related to increasing participation in federal nutrition programs that create months worth of resource. So say a SNAP benefit, or in the case of child meals, that might be a school meal program where they would have access to that food for a long period of time, so like the school year or over the summer, because we know that those programs do create that stabilizing effect for families because they have a little bit longer of that benefit. It can often add to family budgets and can really help stabilize that experience of, I'm going to have to contract my grocery budget in order to make ends meet. So I threw up some 2019 numbers for us because it's a little more apples to apples before the pandemic hit, to give you a sense of when we talk about just the kind of balance of the portfolio, if you will. A lot of our historic and foundational work here at the food bank is investing in exactly what I was telling you about, that kind of supply chain driven, accessing and rescuing surplus food and getting it into the community. 98 million meals. And in 2019, we had about 12 million meals that we enabled through our programming work of connecting people to those federal nutrition programs. But I call out here in this little box on the screen what that looked like in 2020. We went from 12 million meals connecting folks to federal nutrition programs to 23 million meals. Both because of the increase of people who were eligible for these programs, some for the very first time, as well as the fact that Second Harvest Heartland really leveraged the network of programs that we have with our food bank in partnership with almost 1,000 other community partners, as well as 5 other food banks across the state, to really strengthen the navigation work that we do, that support of how can we help somebody find out what programs they're eligible for and support them getting enrolled in those programs. So it's a sizable increase, but when we start talking about how much more is needed to create food stability in our state, we'll see kind of how that shakes out. So I call up on the screen here exactly what that looks like across our program areas. We have programming in a couple other areas as well, but specifically around federal nutrition programs. So that would be things like SNAP, school breakfast, after school meals, summer meals, referrals to the WIC program. Certainly there's a senior meals program in there called Commodity Supplemental Food Program, or CSFP. That's really kind of how that navigation works, and the teams that we have, specialty teams who are some of the leading state experts in the policy related to these programs, and we use that expertise to be able to help people navigate these very complex programs and systems. And the results in 2020 really speak for themselves in terms of the power of having a navigator and somebody who can help you enroll through all of these programs. So again, just a little bit of a snapshot. I spoke specifically about like our 3 programs here at the top, or right here in this right-hand quadrant. In addition to these programs that we have here, we also have a new program that was a pandemic response program called Minnesota Central Kitchen. It was born out of the pandemic at a time when we saw so many restaurants and other like catering services, corporate commissaries, where suddenly not only did they have workers who were not able to work because their restaurants were closed, but there was a lot of food available through food service. Food that was not otherwise accessible to individuals. We're talking like 50-pound bags of shredded cheese, right? Like there was a lot of food that was available for restaurants. And so we had stepped in and said, what would it look like to use those restaurants and to use that surplus food to create hot meals, prepared meals, in some cases medically tailored meals. And that program, again, born out of emergency, but we've really seen the power of having a prepared and packaged meal in combination with the grocery distribution as well as the program work that we do. So I do call that one out as our newest add to the program area. And then the Food RX program on the far side of the screen here is a medically tailored, culturally connected food prescription program. So we're not only thinking about how do we provide folks access to those resources, those federal nutrition benefits that they may be eligible for, how to provide access to groceries, but especially for folks who might be experiencing diabetes or cardiovascular disease, making sure that that food is also really supportive of what they need to have strong health outcomes, to lead a healthy life. So that's the balance of programs that we have at Second Harvest Heartland. So I was talking with Elaine right before we got started, and I would never say it was a silver lining of COVID, but I think an important learning. It's probably one of the largest demonstrations that we have had in our history as a country of the power of these social safety net programs. Because during the pandemic, early on, organizations like Second Harvest Heartland, food banks across the country, we really stepped into our advocacy power because we recognized we needed more than just supports for food distribution to be able to meet the increase of hunger that we were seeing. So for example, our food bank last year distributed 105 million meals, food that went out our door and into the community. But for every single meal that the food bank distributes, SNAP can provide 9. And we saw how vitally important it was to not only keep that program strong, but frankly expand that program, because any changes to the SNAP program is such a large loss of support in the community. It's more than what the food bank could step into to fill, or the charitable hunger relief system could step in to fill. And we saw some really important wins through the pandemic of expansions of federal nutrition programs that you can see on the slides here had an important impact on lifting people out of poverty. And so in many ways, while we are still rallying around that 1 in 10 Minnesotans, because we know we cannot look away from that experience of food insecurity right now, federal nutrition programs really plays an outsized role in preventing further hunger crisis in our country. And we've seen that these are really important for us to not only continue to invest in, but frankly continue to expand how folks are accessing these programs, because again, this is just impact from the last 18 months that we're seeing what a lift that these federal nutrition programs have. Things like expanding SNAP benefits. You might have heard about emergency SNAP. So extending SNAP benefits. There was a program within here that also was very specific for families with children called Pandemic EBT. We could get into the data for those who get excited about data, but really outsized impact on ensuring that families with young school-aged children had an increased benefit for the meals that those kids weren't getting when they were in school. It was a critical program. And we're seeing now from the last 18 months, Center for Budget Policy Priorities, Food Resource Action Council, so many other organizations that have been doing the research over the last 18 months are saying this program specifically, these extended benefits directly to families, lifted children out of worsening poverty. We also saw that things like just direct payments to families were really important in preventing further poverty, especially for families with children. So thinking about stimulus checks or unemployment benefits, getting money to families was really important to prevent further hunger crisis in the last 18 months. What's also really interesting is, and not kind of colored in here right now, there's this important relationship specifically with SNAP for it has an economic stimulating effect, because so many of these direct payment programs that get benefits to families, those dollars are spent in their local communities. The last estimate that I have from 2019 is about 80% of those benefits are spent within the first 2 weeks of receiving them, and well over 80% of those benefits are spent within 40 miles of somebody's home. And for every SNAP dollar that somebody spends in the grocery store, it has $1.70 of economic return, because you need to have somebody who's working at the grocery store, and you need the food that's there and the investment in the transportation, right? Like, it makes sense. And so we see that these are not only really important for families, but it's also really important for keeping jobs in our community, keeping our communities really strong and healthy, frankly. And so this, again, we really saw the impact in the data over the last 18 years. And for us as a food bank, it's only put, I think, further emphasis on where we can expand our reach to do that navigation work to not only screen and help people know if they're eligible for programs, but help and support enrolling them into those programs. So that leads us to, okay, we needed to understand what was going on, and how can we think about how COVID has changed. We see that food insecurity has increased in our state. We see who it is impacting disproportionately, especially families with children, especially our BIPOC communities. But we wanted to understand how big is the thing? If we were to really expand our program impact, what does that need to look like statewide? So we partnered with Boston Consulting Group over the last summer, and they did a long statewide assessment on our behalf and certainly on behalf of the state of Minnesota. And what we found was there are 380 unclaimed meals, federal nutrition program meals. That means people who are eligible for their programs, but there's some systemic barrier that prevents them from being able to take advantage of that benefit. Meals that are already available to people that can't be utilized. We see that this is really, it's a SNAP underutilization question. About 60% of those 380 million meals are SNAP dollars, SNAP benefits that are going unclaimed in our state. And this is a really important piece when we think about supporting children in our state, because more than half of the people who enroll in SNAP or are eligible for SNAP are families with children or people living with disabilities. And so when we think about that, we certainly see that increasing that participation in SNAP and supporting families getting access to that program is a really strong way, an accelerator that we can create more food security for children. We also saw, when we talk about programs, federal nutrition programs, we saw that there were, oh yeah, please. Yep. So that we'll start getting into that, because for those who are online and didn't hear the question, it was like, what do we do with that number? And I will tell you, even my jaw hit the floor when I saw that, because it's about 3x the size of what we distribute as a food bank in terms of just the unclaimed opportunity. We also certainly saw that there was a real question of how are we connecting not only people with the program, but in greater Minnesota. This became very clear for us that in greater Minnesota, there's more systemic barriers to accessing these programs. So we have 4 areas that we are really investing in. We have a focus, what I call, of like, where can we go deep and where can we go wide with Second Harvest Heartland's resources. So certainly within our urban areas, we are investing in adding more people to our outreach and navigator teams, and really focusing on school grants where we can increase that participation in school meals. But in greater Minnesota, where we saw so much more of that need, this is really spurring new partnerships with our food banks, new partnerships with community organizations, with healthcare systems, community colleges, but healthcare in particular, as a way to really increase that connection to these programs, screening for these programs. And certainly this becomes just a direct relationship with our healthcare program. And so it's put a huge emphasis on where are there systems that are not talking to each other, if you will. Where are there ways that Second Harvest Heartland can create that partnership so that there are more referrals into that program? So a couple of examples of what that might look like in practice. We know that for many, many people, when you go to the doctor's office, you will get a set of screening questions. Oftentimes, the one that comes to mind for folks is, are you safe at home? Right? That is in annual visits, well child visits. Our question to healthcare is, can you ask 2 more questions? Do you have enough to eat for the next 3 days? In the last 3 months, have you ever been worried about not having enough to eat? We've heard from so many providers who are having that conversation, sitting with their patients, that they don't want to even ask the question if they don't have a solution. And so Second Harvest Heartland has really focused on how can we create that connection with that healthcare system so we can be that solution. Because we're not asking healthcare to then create all of the social services and human services that's needed, but connect with us. Make that referral with Second Harvest Heartland or might be another community organization in your area who could then support that person with essentially a food resource checkup, if you will. And so when we think about like where there's really easy opportunity for community members, if you're not getting asked that question at your next doctor's office, ask why not. Did you know that there are organizations that could do that SNAP referral? Have you ever thought about doing food insecurity screening, right? Those are really easy ways that we can connect more systems to making referrals to Second Harvest Heartland or other community organizations to support screening and enrollment for SNAP in particular. So an example of where we're doing that now might be in well child visits with providers. We've talked a lot with schools. How are the school social workers screening for SNAP? Where are there ways that we can just create more touch points at conferences, for example? Ways that parent-teacher organizations or school boards can pick up those very easy, how are we screening for food insecurity so that families aren't getting missed, and we can create more of those connection points. And oftentimes, one of the best ways that we connect with community organizations that way is somebody said, hey, I was told to call Second Harvest Heartland because you have a food insecurity screening toolkit. I'd like some materials that we can use in our healthcare clinic. I'd like some tools that we can use at student conferences or back to school night. It's that community connection that can really go a long way in creating more of those partnerships so that a family or an individual isn't navigating all of those pieces, that there's a nice direct connection, and the burden isn't on the individual, but it's on the systems to make sure that we're connecting with and catching those individuals and they're not getting missed. So that's an example. The other ways that we're really looking for people to get involved is through advocacy. As community members, using the ability to use that voice is exceptionally important in keeping these programs strong and accessible in our community. And it is both a balance of where are there opportunities around advocacy to call your local elected official at the federal level, as well as how can you connect in with things that make an impact on a local level. So for example, right now, we know that in the Build Back Better legislation, there's a number of provisions specifically related to child meal programs and strengthening those programs. Things like access to universal meals, increasing the meal reimbursement so that those are financially sustainable programs for school districts, making permanent what we learned from pandemic EBT and turning it into a summer program. Pandemic EBT was intended for when kids are outside of school time, when they're not in the school building. It just increases the benefit available to families when kids aren't in school. We could make that happen in the summertime. That's in fact been a well-established and demonstrated program, but it has not been picked up at the federal level. We have so much learnings now about how that impacts children to have additional benefits for families, increasing that buying power so families can access things like fresh foods at the grocery store with their benefit dollars, their SNAP dollars. So how can we take what we've learned from really horrendous circumstances through the pandemic and make that permanent benefit for children? Because we know in this country, there's always 3 months out of the year that kids aren't in school. So Build Back Better is a really timely example of we need people across the entire state and every community connecting with their elected officials, asking about the status of Build Back Better, voicing your support for these programs and why you care about the child-specific programs that are mentioned in Build Back Better. And these are 2 examples of what you'll see in that Build Back Better kind of package of policy. But there is also the local level where we are asking people to advocate and help support these programs. Universal school meals. All of these waivers you've heard about, things that have been in the news during the pandemic, essentially what it amounts to is we've created universal school meals. Every child can access a school meal. They don't have to be eligible for it, they just need to be 18 or under. And we see that that program is working. I mean, we saw the sizable increase from 12 million meals to 23 million meals. Much of that, about 17 million meals of that, was coming from school meals. That program, making universal meals available to students, is something that is a high priority in the state of Minnesota. That is things like supporting, we call it community eligibility program, but calling your state elected official, calling the local school district, and understanding what those, how they're accessing that program. It's a really underutilized program in our state. Even districts that are eligible for it, we underutilize that program. And so there's ways at the local level that we can just be asking, why is our district not participating if we're eligible? What would it take for us to become eligible in that program? That is a very powerful way to affect change at the local level, as well as supporting things like the additional education benefit forms, breakfast after the bell, simple programmatic changes that really lift how many kids are participating in a school meal. And I call it breakfast after the bell in particular. This is a fabulous example of where small changes have a huge impact. We partnered with the South St. Paul School District. They wanted to increase the number of children that were participating in the breakfast program. They had a lot of children who were eligible for free or reduced price meals participating in lunch, which makes sense, kids were already in the building, but breakfast was not being well utilized. Turns out, the buses were dropping kids off after breakfast was done being served. And it was being served in the cafeteria, which meant kids had to get all the way across the building, and then they were kind of singled out, especially for the middle and high school kids. That doesn't feel good. So when they put breakfast in between passing periods and every child had access to it and they could just grab and go breakfast, or for their middle school students, when they put their breakfast carts right outside the doors where the kids are getting off the buses and timed it out for when the buses arrived, had a 400% increase in children participating in that program. So there are very easy ways at the district and school level that people can engage and talk about how are we making these programs more accessible for folks, as well as certainly thinking about where can we increase screening for SNAP. In schools is a fabulous example, in the doctor's office, fabulous example, but certainly places like where else are there food programs? A backpack distribution, a produce distribution, the local food shelf. Where are we screening for SNAP eligibility? And if it's not those organizations, how can Second Harvest Heartland step in and do that screening with our team of experts? And so really just great ways that community members can start to connect the dots between all of these different systems and make it easier for families to access these programs. In addition, of course, there are ways also as community members that we can continue to support this work. Certainly, donations to Second Harvest Heartland goes to keeping our navigation team strong, supporting our food resource center, and ensuring we have the resources to continue doing this work, as well as volunteers. We love when folks come in and volunteer and pack food boxes. If you're excited about and ready to volunteer in person again, we have a need for volunteers every single day to pack food and to make that accessible to the community. But we also have a need for volunteers to come in and help support that screening and that navigation work. To work on the phone when somebody calls and says, I don't know what I'm eligible for, to help screen, help them understand what they might be eligible for. This is something that can be done both in our offices and virtually. We moved that so that folks can do some of this work at home. And so it's a really good option for people to volunteer if you are really looking for more of that direct connection, as well as volunteering with our Food RX program. Those patients who are enrolling in the program who need a medically tailored connection to food, as well as food resources. So there's some really great volunteer opportunities if you are looking for more of that interaction with an individual. And then, of course, we're asking folks to advocate, like we just talked about. How can we keep these programs strong? We learned an awful lot about how to make programs more accessible during the pandemic, and we think it is critically important to keep those programs accessible as our communities recover from the last 18 months. So with so much complexity and scope, Second Harvest Heartland, we really talk about our organization being like an engine that's fueled by generous donors and supporters and advocates. Our volunteers, it's like the equivalent of about 65 people. That's how many volunteers engage with Second Harvest Heartland every year. We could not do this work alone. And so we're so appreciative of folks like this conversation today, asking how can we get involved, whether it's through advocacy, whether it's through volunteering, or certainly through donating. But volunteers was really the engine that keeps us going. So if you have questions about how to volunteer, if you have questions about how to stay informed of advocacy areas, certainly grab me after today's conversation. I'll also put my contact information up on the slide for everybody. The last piece that I would mention is that you can visit toharvest.org/advocacy to sign up for just an easy newsletter. We'll inform you of when there are quick ways that you can make a phone call, send an email, get involved. But using our voices now collectively as a community, we see as one of the most important pieces to keeping these programs strong and available to everybody in our community. So thank you so much for your time. I've been trying to keep an eye here to make sure we've got a little bit of time for questions. But while we do that, I'll also put my contact information up here. Please feel free to reach out if there's any other ways that I can get you resources, toolkits, or more information about how to get involved. So thank you so much.
Hi, so in the room, please raise your hand with questions. And if you're online, please type your question into the chat box.
What was the email address you just said? It went by very fast.
So to Harvest, the number 2, and then harvest.org/advocacy. My colleague runs this really fabulous newsletter, and it just creates really easy ways to provide sometimes even content for you, right? Really easy ways that you can take action as a community member in the advocacy space.
Another question, you were talking about volunteering, which it sounded like people would actually be navigators. They'd be functioning as navigators, helping people through phone or maybe in person, but get through the system. I assume that is about getting access to those benefits that are going unused.
Correct. So one of the things that we find is it's really important even just to do that screening. So oftentimes our volunteers will help with that screening. What are you eligible for? So that we can connect you with the right navigator at Second Harvest Heartland. So you might be eligible for SNAP and CSFP, or NAPS is what we call it in Minnesota. So how can we get you to somebody, right? Like we want to really help do some of that upfront work. So we're not transferring people around. We really want to do that all comprehensive kind of review right away. So that first touch point. But we also know the other piece is it's not just the federal nutrition programs. How do you know what you don't know in terms of where's my local food shelf? When do they have it? What could I visit? When do they have a produce distribution? And so we like to provide that kind of information as well. So when we talk about navigating, it's really about bringing charitable hunger relief and human services together so that someone has to make one phone call instead of 4. That became abundantly clear in the pandemic. That it's a full-time job just to find out what you're eligible for, and then I have to go here to my child's school to pick up meals. I have to go there to get my SNAP application. That's where my food shelf is. Really trying to make it as easy as possible for an individual so they can call one person. We find that that's a really big part of how we make these benefits more available to folks.
Thank you. We have a question from the chat. Theresa, thank you for a really informative and impactful presentation. Could you share more about how input from the people served by Second Harvest has helped shape its work?
Oh, that's a fabulous question. I think one of the best examples that I can give is actually within our Food RX program, a really tangible piece. When we saw that there was such a relationship, and anyone who's been in medicine is like, when we saw there was such a relationship with the type of food that people needed to really support what their medical diagnosis was, particularly with those really diet-sensitive diagnoses. So think diabetes, cardiovascular disease. We certainly right away wanted to tailor those prescription boxes, right? It wasn't about just having access to food. It needed to be food that was going to be very supportive of that diagnosis. But we heard right away, it's not one size fits all. We spent a lot of time getting feedback from patients, doing user experience focus groups, really trying to understand what's the type of food people want to bring home. And so those boxes are culturally connected as well. We adapted all of our menus so we could have a Latinx menu, an East African and Somali menu. Right now we've got a really fabulous produce pilot with some among growers, small growers, to bring in more of that produce, because it's got to be food that people want to bring home, that feels really like it's supporting that dignity in food choice, that it's food that is feels good, right? There's dignity to that experience. And so really thinking about where we can continue to bring in more voices to shape the foods that are available and give more choice to people so that they can have access to the foods that they would choose at the grocery store. It's another big piece why we really support and advocate for programs like SNAP, where folks can receive the dollar benefit and then they get to choose the types of food that they want to bring home for their families and bring more of that dignity and experience into it. So that's an example. But we do a lot of that community engagement work within our school programs. We help facilitate that with some of our school partners who really want to bring in, parent voice, family voice. We had, with our Minnesota Central Kitchen, we partnered with Roseville area schools, and it was parent liaisons within the school district that helped design and shape those menus. So there's just some really good examples of how are we ensuring that it's not a one-size-fits-all approach, but we're really listening to the folks who are accessing this food to make available the foods that they want to bring home to their families.
Great. We have one more question in the chat. Can you speak again about the 1-to-9 ratio about that the SNAP benefit helps to bring about? And can you just maybe even say a little bit more about
Expand
that?
on that? Absolutely. So the stat that I shared was for every single meal that the food bank provides through our direct distribution, SNAP can enable 9 meals. And that's because the program is so expansive relative to charitable hunger relief that can serve that many more people. So think about it this way. There's less supply chain, if you will, right? The benefit goes directly to an individual versus many organizations needing to invest in how are we moving the food, how are we packaging the food, how are we repackaging the food so it's accessible to take home. And so that's a really good example of where just the investment in charitable hunger relief, we know that is a vital part of how do we respond to the need today, but it takes a lot of investment in charitable hunger relief. Whereas we can much more quickly impact when we invest in that access to SNAP, because it doesn't require all of that other kind of administration, if you will. So SNAP is just a larger program than what charitable hunger relief can be, is a way to think about it.
Thank you so much. I think we have time for one more question in the room here. Thank you.
Can you explain a little bit more about that breakfast?
Yeah.
Or after the bell? Or
Breakfast
before
after the
or
bell,
whatever?
yeah.
What is it, and how do the kids pick it up, and do they eat it during school?
So, school breakfast program has been around, I want to say the 70s. Don't quote me on that one exactly. 70s. And it's about making a meal available to children, particularly kids who were enrolled to receive a free or reduced priced lunch, right? How are we providing just an additional meal? And oftentimes breakfast would then be served in the cafeteria before the school day begins. And we make that meal available because we want to be able to feed feed children. But when it's available to kids in the cafeteria before the school day begins, there's other barriers for children to be able to participate in that program. It's not enough just to have it available, because now there's a question of can a guardian or parent get that child there in time to eat that meal? When is the meal served? Especially with our middle and high school kids, do they want to be sitting in the cafeteria themselves and really singled out, right? And so the program has been around for a while, but we see small tweaks to how that meal is served can really change how many kids are participating in that program. And it can happen a number of different ways. We find with elementary school kids, one of the best ways to serve that meal is actually in the classroom. So we call that breakfast in the classroom. So that may often be during, if you have any kindergartners in your life or those real littles, for a second, they might have a morning meeting or they might be doing attendance. So a real nice way that kids can eat that at their desk together as a classroom community. And then those items just get picked up and back off to the kitchen, anything that was left over or trays, whatever that might look like. That's actually the model that's been used during the pandemic when kids are back in school and they're eating their meals in the classroom. So pandemic meals have actually used that breakfast in the classroom model to be able to serve kids at a time when social distancing was really important. With our high school and middle school kids, that might look a little different. They may have like a more of a grab and go option from a cart in between classes. We know that our high school kids in particular, developmentally, they're just not ready to eat until a little later in the morning. Their brains are not quite awake yet at 7:25 in the morning. And so serving that maybe between first or second period, where the kids are passing between lockers and they can go through to the keypad, grab and go, and eat on their way to class, that often works really well. They're also a little bit more mature and can handle more of that independence with their meal versus the younger kids. So there's a lot of different ways that that can look at the individual school level. But the kind of broad theme is that when you bring that into the school day, just like lunch is a part of the school day, the meal is more accessible. And so that's, I think, one of the pieces that we're really focused on when we talk about school meals is how are we making that accessible? How are we reducing the barriers for kids and for families to take advantage of the meals that are there?
Great, thank you. Thank you, Teresa, for sharing your insights and perspectives. We really appreciate you sharing these with us. Next Sunday at the Social Justice Forum, we will welcome Reverend Dr. Curtis DeYoung from the Minnesota Council of Churches, who will be speaking on radical reconciliation. Please be sure to join us then. Thank you so much for those in the room and for those online and sharing your thoughts and questions in our conversation today. And thank you, Teresa, again.
Thank you for having me.